I'm Dr. Jeremy Bosworth, and I'm a plastic surgeon and fellowship-trained aesthetic surgeon here at North Texas Plastic Surgery. Today, I want to talk to you about something that I deal with all the time in consultation, and those are plastic surgery myths. These are things that people come to me that they're worried about, that they read about or heard about on social media, and I wanted to kind of go over some of those and say what's true and what's false about those. One of the big ones that I hear about is that if I have plastic surgery, I'm gonna look fake. And that's just not true. Sure, there's people who come to me and they say, I want these fake looking breasts, or I want to look augmented. That's honestly the minority of the people who come to me, and most people just want to come and get a little bit of enhancement to their current look. And the truth is, that's a look that I really like to do. I like to keep people looking natural and just enhance their own beauty. There's probably a majority of people out there walking around the streets that have had plastic surgery and you would never know it. Sure, there's the people out there with their breasts hanging out, or maybe you can see some scars when they're wearing a little bikini at the pool or something. Those people have had plastic surgery, but the majority you would never know. The look that I like to go for is the look that I always say, if you want to show this off, you'll be able to show this off and look really good. But then when you need to cover it up, or you just want to look natural and like yourself, people say, wow, he or she looks really good, but they don't know that you had something done. It's just a nice enhancement of your own body. The next myth I want to talk about is liposuction, and that liposuction is actually a weight loss tool and it helps you lose weight. Well, yeah, overall, you're gonna lose a little bit of weight, but the overall amount of weight that you lose is not significant from a weight loss perspective. It's really used more as a contouring tool to target areas of stubborn fat, to help blend lines in together, make the whole body look harmonious together when we're doing surgery. But it's not meant as a weight loss tool by any means. You'd be surprised at the amount of weight that comes off, even when we do a big surgery where we're cutting out skin and fat. And liposuctioning, the amount of weight that you actually lose in these surgeries is not that significant, and it's a whole lot less than you would think. You'll lose a little bit of weight when you do this, but it's not gonna change the overall look, and you really need things like diet, exercise, or some of the new medications that are out helping people lose weight. On the same topic of liposuction is another myth that I often hear, and there's some truth to this, but it's not really what people think it is. And that's that after you have liposuction, you're either never gonna gain weight in that area again, or that you preferentially gain weight to these other areas all of a sudden. And that's not entirely true. Here's the truth about it. When we do liposuction, we do remove fat cells. And when you gain and lose weight in your normal day-to-day life, your fat cells are really just shrinking and gaining more size back. You're not actually losing fat cells when you lose weight with diet and exercise type stuff. But the liposuction actually does remove those fat cells. So you do have less of the fat cells in the areas that we target with the liposuction. But one, we don't remove every bit of fat from any areas. That's just not safe to do. So you're still gonna gain some weight there. And all the other areas that we didn't target are gonna gain and lose weight just like they did before we did surgery at all. It's just that it might seem like they're gaining more weight than, let's say, your tummy, if that's where we did liposuction, because the tummy doesn't have quite as many fat cells. But it's not that the legs are now gaining more weight. They're gaining the same amount of weight that they were before. They're just in relation to the tummy, more weight is gonna be gained there because they have more fat cells to grow and expand. On to the next myth, and that is that with a tummy tuck or some of the other surgeries you do, you're not gonna have a belly button. This is something that I've seen on social media, or people have asked me. It's a very common question I get asked about, what is my belly button gonna look like after a tummy tuck? You should have a belly button still. It's just not true that you're gonna lose your belly button with every tummy tuck. Ask 1,000 plastic surgeons, every single one of them is probably gonna have a different belly button technique that they use. And there's not that one is right or wrong. We've all perfected our own techniques, and they all might look a little bit different. And I've got a couple different techniques I use for different things. But I love my belly button. I perfected it over the years. I think it looks great. The next plastic surgeon you talk to is going to say the same thing because they like their belly button. What's important, look at before and afters of the plastic surgeons that you're going to and see if you like the look of their belly buttons. And if you do, then you're probably going to get a similar look to that. If you don't, then maybe move on and find a different plastic surgeon. But The belly button's a super important part of the tummy tuck procedure. It's something that I take a lot of pride in to try and make things look natural and keep it looking really good and in a good position, but you should have a belly button. Something else that I hear all the time is that this is gonna take months to heal. Well, there's some truth to that. I always tell people that, scars can take up to a year to fully heal and mature and for all that color to go away and fade as much as possible. Swelling can take months for it to fully go away, but are you gonna be like you are on post-op day 1 for months? Absolutely not. Over that period of time, you're gonna slowly heal and slowly get better. I always say, first week, gonna have a lot of swelling, bruising, things like that. By 3 weeks, usually gonna start to feel a whole lot better, start feeling more like yourself. By 6 weeks, you should be feeling really good, still with some reminders that you just had a big surgery. 3 months should be fairly normal, still with a little bit of swelling. And by 6 months to a year, you're gonna be pretty much back to normal. But just because it can take up to 6 months to a year to see those final results doesn't mean you're gonna be walking around looking like some plastic surgery nightmare or some swollen, bandaged person. Everything's gonna look normal to everybody else. You might see some changes and see a little bit of swelling when you look at yourself in the mirror, but things are gonna look absolutely normal to everybody else. Another myth that I have to deal with all the time is that you can get plastic surgery in another country or another state for a lot cheaper and it's gonna be the same thing. Look, there's great plastic surgeons in other countries. There's great plastic surgeons in other states, and that's fine. If you've done your research, you know their work, you know their results, maybe you've talked to patients or seen patients that have had work by them. By all means, if that's the plastic surgeon for you, go with them. But don't go to somebody that you haven't done your research on, you don't know their training, you don't know their experience, just because it's cheaper. A lot of the times, you might get away with it. If you do, you're lucky and you saved a little bit of money, but man, that's a big risk to take because if something goes wrong, and believe me, it does. I have dealt with disasters from these plastic surgeons, or sometimes not even plastic surgeons, from some cosmetic surgeons or pediatricians or dentists who are doing some of this work in other countries. It's not a good idea just to save some money. Find a plastic surgeon that you like their work, that you trust, and that, is gonna do the work that you wanna do. This is forever, and this is your health and your life. It's not worth taking that risk. And that's how you should choose a plastic surgeon, not just to save a little bit of money and put your health and your life at risk. Another myth that I hear about in clinic or on social media all the time, or even from other doctors, is that there's a certain time period that you can keep your breast implants for. And, you'll often hear or read 10, 12 years is when you should replace your implants. That's not entirely true. The FDA says that breast implants are not meant to be lifetime devices. Meaning you're not meant to get them today and take them to the grave with you. But if there's no problems, everything's going good, you're getting your regular screening, and everything is going fine, you can. The 10 to 12 year time frame that you'll hear about is probably the average that people get their breast implants exchanged, but it's not because they have to, just nothing else is going wrong and they just want to get their breast implants exchanged. Now some people do and will do that if they have anxiety about having the breast implants for so long. But that 10 to 12 years is more commonly because of the body continuing to age around the implants, not because of an implant problem. Implant problems would be something like rupture or capsular contracture. Those are some of the things that you might see that you would need to exchange your implants for. But more commonly, the body's gonna continue to age. Breasts are gonna continue to be affected by gravity, the weight of the implant. Maybe you want a lift at this point in your life, a different sized implant. You're just not happy with the look of things. That's the more common reason. After about 10 to 12 years, the risk of something happening to the implant does go up. The shell's been rubbing together for a while, it's weakening a little bit. So if we're gonna go in for something else, let's say a lift, and you've had your implants for about 10 years, then I'll recommend exchanging the implant to get a new set in there, kind of reset the clock on everything. You're already going to sleep anyways, you're already having surgery anyways, then we'll exchange the implants. But simply because your implants are 10 years old, does not mean that we have to go in and exchange the implants, put you to sleep, put you at the risk for surgery if everything else is going great. Another myth that I talk about with patients all the time is that surgery results are only temporary, or that they're gonna wear off after a certain amount of time, or how long is this gonna last? Well, it's true that it's not necessarily forever. This isn't some magic that's gonna stop the aging process. Your body's gonna continue to age whether you have surgery or not. I like to say that when we do a lift, for example, or a tummy tuck, or whatever surgery we do, we're kind of resetting the clock at that point, but your body's still gonna continue to age and have the effects of gravity, of aging on the skin over time. And that's a part of this that we can't quite change yet, just the genetics of your tissue and of your body. Everybody's body's gonna age different over time and be affected by all those things of aging over time. And that's just something that, I can't necessarily predict. I've got techniques I can use to help with the longevity of the surgery and how long things hold up, but it's not necessarily a forever thing. At some point in your life, you might want another lift, or your skin might relax a little bit, or your breasts might not sit as high as they did when we first did the surgery. But we're gonna get things to last as long as possible for each person's individual body. Things are gonna look great. We're gonna reset the clock, and then your body's gonna continue to age over time. So those are just some of the common myths that I hear about pretty regularly. There's many more of them out there. If you've got a myth you've heard, you're not sure if it's true or not, and you want me to talk about it, you want an answer to it and see if it's true or false, leave it in the comments below. I'll do my best to answer any questions you guys have, expel any myths, and like, comment, subscribe if you like this video. Really helps us out. We're gonna get as many answered as possible, and thanks for following.